Welcome to the show today. We're talking about healthcare with the Great American Health Alliance. With us is the candidate running in Rhode Island. Why don't you introduce yourself?
Vic Mellor. I'm running for Congress in Rhode Island's 2nd Congressional District.
And where is that in Rhode Island?
It's the west side of Rhode Island.
Mm-hmm. Excellent.
The rural side, if you would say.
Well, tell me a little bit about you. How did one come to run?
Born and raised in Woonsocket, Rhode Island. Single mom. Grew up on welfare. Grew up in the projects. She got pregnant for me when she was 15. So thank God for my grandparents for, keeping me around, kind of thing, right? Well, it's important. So I joined the Marines in 1988. I got out in 92. I stuck around in Rhode Island for a few more years. There was no opportunity there, as there is not now also. Rhode Island is the worst state in the union for child retention. Everybody leaves. Oh, yeah. Rhode Island is last on a lot of issues, and healthcare being one of them, okay? We got a handful of hospitals, and 2 of them just filed bankruptcy for the 2nd time. So it's hemorrhaging there. So what we want to do here is definitely going to help all Rhode Islanders. I moved to Florida. I became a businessman, successful. I own multiple businesses, one of them being a healthcare clinic that I got into during COVID because people, just like my own kids during the whole COVID thing, pediatricians were forcing a shot, forcing a mask, and we're just like, no. I found out that thousands of people weren't going to the doctor either. So at that point in time, I had a place called The Hollow, which was a refuge that I had built for, it's constitutionally based. And so what I would do is I would get doctors out there once a month that got fired by the system. So which now they're getting their jobs back and getting back pay, and having the people that weren't going to the doctor go to my place and meet up once a month. So that was happening. And
Underground healthcare.
Yes, it was. Yes, sir. we were just connecting people and like-minded, and this is you trust them. If you can't trust your doctor, who can you trust, right? So it took me about 6 months before I bought a building, and I was able to open a clinic so the kids could go to every day, or it was available every day for patients.
And what during that period, what did you hear most from patients of what problem were you solving for them?
Well, everything at that point was COVID, right? And just how they are forcing the mandates, just boom, no informed consent whatsoever, that the healthcare system was lost, right? Pushing remdesivir for treatment when overseas they stopped using it because it's killing everyone, but it's okay here, right? So the trust on the system was totally broken, and what it did for me is I being a Marine would just line up and give me the shots, boom, 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 and it opened my eyes to this whole world of autism and just chronic diseases caused by our childhood shots. So that's a major component of what we do at my clinic. We just take care of as many kids as we can, and it's working.
How big is it now?
My clinic, it's a 10,000 square foot clinic, and we're getting ready to open up a couple more in Florida.
Wow.
I know, and I'm working on opening one up in Rhode Island right now. It's going to be a little harder in Rhode Island because of the stricter controls that they have there, but I don't care. Arrest me if that's what you need to do.
So that's been your life passion, really, to help people in healthcare.
Well, I don't know about my whole life passion.
Yeah, but I mean this phase of your life.
Yes, no, absolutely. I don't know how you. So, on a business aspect, the healthcare, it was on a business side. It's the dumbest thing I could ever do, and it just is because. Especially a health and wellness clinic, which will be addressed in one of our pillars for GAHA, is insurance companies won't pay any health and wellness. So it's a self-pay part of what we do. And so how do I, as a person, say no to somebody that doesn't have enough money for treatment?
Yeah.
You just can't do that. So just like the government, I subsidize my health clinics just to keep it afloat, and so the people that can't afford it can still use the treatment.
Because the system really isn't built to help people stay healthy. It's just sick insurance in case you're sick. So you're helping all these people that want to stay healthy, and the system doesn't allow them to have extra dollars for that. Is that what you found?
Yeah, yes, sir. Well, we know 81% of Americans know that the SickCare system is broken and it needs to be replaced, right? It's not based on the people, it's based on making a profit, right? It's just on profit, and the evidence proves it out. You know, the costs are skyrocketing, but yet our health is declining and we're living less longer, right? So, I mean, how do you have both of these at the same time and say it's a successful system? It's broken and it needs to be replaced.
Well, the government was shut down here in Washington for 44 days based off of the push for government subsidies. And then suddenly the president kind of out-messaged the public or the opposition and said, give the money directly to people. And now no one talks about health care, but it's the #1 issue on an affordability race. You seem to be leading into it.
Oh, absolutely. It's one of the major platforms on what I have. I live it every day in my everyday life. I understand how unaffordable it is, and I understand how health and wellness can change somebody's life, right? So yeah, I'm all in. I'm all in. I mean, I don't know if walk in my shoes for a month with people smiling because they're better, or the tears because they've spent all their money in sick care and nothing has changed for them, or they got worse, right? And yes, you know, you referenced President Trump talking about, you know, bypassing the insurance companies and getting that money directly to the American citizens, right?
Yeah.
And the best way to do that is through the health savings accounts, right? So that way, if they just get the money, if he wants to write a check for the tariff money anyway, right?
Yeah.
So we're like, hey, let's push this. Like, this is a great idea. Instead of just cutting checks and then the people have to pay taxes on it, let's open up health savings accounts, put the money in there, and it's tax-free money, and then American citizens can spend that money any way they want. But obviously there has to be some changes in Congress, which, you know, with the GAHA, you know, we've created these 4 pillars, and pillar #1 is the decoupling of the healthcare system from government funding. So that money can go directly to these health savings accounts. And the best part about the health savings accounts, as long as we get them passed through, is that money stays in there year over year over year. And if you don't get sick, then you don't use it, and you still got it. So if you're a younger mom or a younger family, you don't lose that money every year. You're not renting the health care. It builds with you as you're getting, and then if your kid breaks a leg playing baseball or football, then you can use it. Boom, it's there for you to use.
So walk through what that means for young people in a system right now that they're relatively healthy and they're just paying every month for insurance that is not high deductible for the most part. What does it mean in their life if young people can have these accounts long term?
Well, so when the ACA came out, Obamacare came out, right? The Affordable Care Act, that was the hardest part of what they were trying to push it, is because young people are relatively healthy, right? You know, COVID's changing that a little bit right now, or a lot, right? So they don't want to pay for health care because it doesn't affect their day-to-day life, but the money that goes for less and less further every day, they need that money to survive. So that's where these health savings accounts, you don't lose them.
Yeah.
You just keep building it and building it and building it as you grow. So,
and it's separated from your work. It's yours. You own it.
Yes.
Not many things in healthcare do you own.
Yep.
That's really interesting. And then the other pillar that I know you're running on, by the way, you're one of the only candidates that has leaned in, because of your experience, you feel comfortable talking about healthcare. A lot of candidates don't talk about healthcare, but you're one of the national leaders on this. One of the other areas is more transparency. There's this 1/5 of our economy is secret. We don't know what the price of anything is. If you're going to have a medical procedure and you ask your doctor, how much is this going to be? He or she don't even know how much they're getting paid going in. It's odd, but you've embraced this from the beginning.
It's not only odd, it's crazy. I mean, it's like it has to be the only anything anywhere that you do where you don't know what it costs until you get that bill in. And that's where the fraud comes in. And it's so evident And the younger people realize it now too, because they live in this life of always having this constant information that they have at their hands all the time. You know, what do you mean this, you don't know how much it's going to cost because I got a broken arm?
Yeah.
Right? You know, my kid, you know, that same kid that broke his arm playing baseball or football, you don't know what that's going to cost?
Yeah.
I mean, that's just crazy. And we have to do this because and everyone sees it, and it's plastered in the news where the fraud is just blanketing our country. And to say that it's not in the healthcare realm of 1/5 of our economy is just crazy.
Well, that's where I think transparency, and we're pushing some of the stuff on the Hill, and you've been a big supporter of that, trying to move Congress to get more transparent. What's the price? And then also, let's secure the process. This process isn't secure because people don't know the price. It's kind of a secret society. And then one of the other areas is the lowest price for drugs. That's a big concern of people, and hopefully Congress can do something to
most
lock in.
favored nation. Right?
Yeah.
So the president has already signed an executive order on this, and it's amazing. So prior to this, the United States basically paid the highest prices and subsidized the rest of the world so they could have the cheapest drugs. I mean, it's just crazy to me, and it has to stop.
Yeah.
There's many aspects of what we do globally where the United States subsidize the rest of the world. And when I'm in Congress, I'm going to say that shit is going to stop.
Yeah.
Done with me. It's not happening. We can't be $40 trillion in debt and think we can afford to pay for the rest of the world to have a higher quality of life than we do.
Yeah.
So as far as the healthcare side of that, yeah, you know, I like if Uganda's paying $5 for a certain drug, then we're going to pay $5 for it. You know, if UK's paying $10, then we're going to pay $10.
Yep.
And that's what happens when a businessman is running things. You know, the president is just revolutionary, and you know.
I think that's got him during the whole shutdown. I think he looked at the subsidies, being a money man, and said, this doesn't make any sense, giving people $770 billion for $10,000 deductibles was just a waste of time. It made no one healthier. So it is an interesting part. You've been one of the leader on this. Obviously, this is an affordability cycle. This election's all about affordability, and people talk about eggs and price of gas. But really, the affordability of healthcare is what's hanging over everybody. Have you gotten a sense of that when you've been on the trail?
Oh, absolutely. Rhode Island is, well, it's not just affordability, it's sustainability. And Rhode Island's going through a problem right now where 2 more hospitals just filed bankruptcy. So it's not just affordability, it's just broken. The whole system is just broken, and it doesn't work. It needs to be simplified, right? The only people making money in the healthcare system in Rhode Island is the insurance companies. You know, doctors aren't making any money. They're moving out of the state. Nurses are moving out of the state. The whole system is broken. And all we need is a revolutionary act that's not that hard to do. This isn't far away. This isn't that complicated. It needs to be simplified, and we can get this done together. I firmly believe that.
Well, thank you, Vic, and good luck on the race. Please follow our movement. You can follow us online at thegreathealthalliance.org, and you can follow us on social media at the Great American Health Alliance. For more information, follow us on this very important year to get Congress moving.